Dr. Suzanne Steinbaum is a cardiologist and director of Lenox Hill Hospital's Heart and Vascular Institute. Good morning, doctor.
I have to tell you, women come up to me and ask me so many different questions. So let's take the time today and let's talk about it. Let's talk about women's health. It's not only listening to your doctor, but it's also asking your doctor questions. The three major tests that you will be having today is an EKG, an echocardiogram, and a stress test. First of all, we're complicated. There are hormonal differences, mechanical differences, there are aging differences. Practice of medicine lags about 10 years behind the science. So the more that a woman knows, the more that she empowers herself with information, the better she is. So go in there with power. Go in there with information.
Don't apologize
Don't
for yourself.
apologize.
I like it.
Do it. I gotta tell you, Travis, 75 to 80% of the time, heart disease is preventable. The blood sugar that's greater than 125, that's diabetes. But when we have a blood sugar 100 to 125, it's a pre-diabetic condition. Eating these kind of foods, these simple sugars, carbohydrates, can lead to an elevation in triglycerides, increasing belly fat. Those that are living a healthy lifestyle tend to be taking the vitamin supplements and potentially eating healthy, but we don't need the vitamins, we can do it with the food.
Okay.
And exercise is the most potent medication we have. This is a weight-bearing activity. You are actually using your own body weight, carrying yourself around the floor. You're going high, you're going low, and all of these activities actually helps your bone health as well. When women are younger, they have estrogen, and with estrogen, the HDL is naturally higher, but Jeannie, as we get older and the HDL goes down,
Yes.
the estrogen goes,
Yes.
and we lose our protection. But there are things we can do. I mean, fitting in time to take care of yourself could be a daunting task. If we all had our personal chefs and personal trainers, we would have it all figured out. But the truth of the matter is, we all live these very complicated lives. We're juggling so many different things. Now listen, you go to the supermarket, you go to the bookstore, and every single day there's a new fad, there's a new way to eat, water diets, cabbage diets. But here is a diet that really helps us take the best care of ourselves. It is so hard to diagnose heart disease in women. It looks different. It could be nausea, shortness of breath, fatigue. The symptoms are just different. I'll never forget, I was in the emergency room in my training, and a woman came in and she had indigestion, and they put her in the corner. And while she sat in the corner, not receiving medical care, she had a heart attack. It's so interesting. There are tons of hormones that go through the body. And as they go through the body, it affects the heart. The heart starts increasing. These hormones can actually give you chest pain. Most older Americans are not used to talking about sex. But let's talk about sex. As you get older, you can enjoy it more, you can get better at it. It promotes your immune system, and there are actually anti-aging properties. This is the EKG. This will tell us initially if there's something very, very scary going on. In fact, getting a family history is the most important thing, and a coronary artery calcium score might actually show plaque inside the arteries in these women that we thought were actually at low risk. Sleeping less than 7 hours, you're just not getting enough sleep, enough regeneration. So that window, that real small window, sleeping about 7.5 hours a night is perfect.
Taking charge of your own health.
There you go.
Dr. Suzanne Steinbaum, thank you so much for being here.
Thank you.